I'm going to talk about the Anti-Mullerian hormone that is found in the chromosome number 19. I hope you find it interesting, and let's continue with the presentation. Now I'm going to speak a little bit about important things that you have to know about this hormone. Anti-Mullerian hormone, also known as AMH, is a glycoprotein hormone structurally related to inhibin and activin from the transforming growth factor beta superfamily, whose key roles are in growth differentiation and folliculogenesis. Also, it's a substance that secretes the ovarian follicles. Its determination is a novel method for measuring the ovarian reserve that is being implanted in reproductive medicine. Another thing that is essential for you to know is that if these hormones weren't there, men would have a uterus. And in the next table, I'm going to explain you a little bit more about this hormone. Now in this table you can see the levels or the values of AMH in women. If we have AMH levels below normal values, it means that we have a low egg reserve, and that is that you have less chances of pregnancy when starting an assisted reproductive treatment with your own eggs. But what happens if you have a very high levels of AMH? If the levels of AMH are very high, it's likely that we may suffer from polycystic ovary syndrome. Polycystic ovary syndrome is a variable disease that is marked by amenorrhea and ovarian enlargement, and is usually initiated by an elevated level of luteinizing hormone, androgen or estrogen. And I think this is the most important thing of this hormone, its functions. Secondly, I'm going to talk about ovarian. AMH is expressed by granulosa cells of the ovary during their reproductive years, and limits the formation of primary follicles by inhibiting excessive follicular recruitment by FSH. And as you can see, it has other functions. AMH production by the Sertoli cells of the testes remains high throughout childhood in males but declines to low levels during puberty and adult life. And how does this hormone affect people with cancer? Well, in women with cancer, radiation therapy and chemotherapy can damage the ovarian reserve. In such cases, a pretreatment AMH is useful in predicting the long-term post-chemotherapy loss of ovarian function, which may indicate fertility preservation strategies, such as oocyte seropreservation. Well, generally speaking, the functions are the same, but AMH measurements may be less accurate if the person being measured is vitamin D deficient. Males are born with higher AMH levels than females in order to initiate sexual differentiation, and in women AMH levels decrease over the time as fertility decreases as well. So I hope you liked the video and you learn a lot about this hormone.